And here's a nice shave. And again, you can see a dermal infiltrate. When you look at an infiltrate from low power, if it's really blue and diffuse, it's probably lymphocytes, right? If it's really pink or gray, it's probably histiocytes. It's not always true, but that's a useful thing because histiocytes have a lot of cytoplasm. That's why they look more pale, because the nuclei are spread out from each other by extra pale cytoplasm. So that's a kind of useful low power way to start thinking about histiocytes. And when I was wrong. Look, this is not actually histiocytes, it's collagen. So see, I told you, it doesn't always work. But these areas are histiocyte aggregates. And so aggregates of histiocytes are granulomas. You don't have to look around very long on this case to find the organisms. These big, round, cystic structures are classic for cocci, and they're too small to see, but they're tiny little endospores, sporangia, that are inside the cyst. So sometimes the cysts are filled and you have lots of little tiny dots in them. Sometimes the cysts break open and spill their sporangia out into the dermis and then leave open, empty cystic structures. So sometimes they won't always look perfect like that. Sometimes they're broken down. And of course, with a lot of these fungal infections, where you are geographically matters a great deal, right? If you're in the American Southwest, cocci is really common. We never see cocci where I live in Arkansas. We see histo all the time. You can see blasto sometimes. So there's certain things that are very different geographically depending on your kind of environment and whether or not the fungus likes to live there. So that's Coccidioides, Coccidioidomycosis.